Hi, everyone. Good afternoon. This is County Executive Pat Ryan. I hope you have been well since our last update. I know on Tuesday we mixed it up with my state of the county, so it's been a week since our last COVID update. Lots to share today. At the high level, there's some very good news in terms of the COVID situation. We are clearly on the downslope of this second wave that we have been in really since the holiday period. We'll talk through the metrics, making that clear, but that is encouraging news. We still have a ways to go, but we very much now think that we're through the worst of the second wave and heading in the right direction. And that's thanks to really the collective efforts of everybody doing the right thing to get this back under control. The other thing that I'll talk about today, of course, is where we're at with vaccinations. That is the challenge, and I know the point of continued concern and frustration for many, including myself. So I'll have a significant update today on that and continued efforts that I and we are making here to work with the state and with the federal government to be as proactive as possible to get more vaccine supply so that we can get everybody vaccinated as quickly as possible, given that we know what is at stake. So diving in first to the COVID update by the numbers, current cumulative cases now at 10,435, almost 270,000 tests administered. Fortunately, 8,558 have recovered, and tragically, 227 now of our fellow residents and community members, family, friends, colleagues, loved ones have passed in the last week since my last update. That's 5 additional members of our community that have succumbed to COVID. So very much thinking of them and their families. And of course, a reminder of the seriousness of the work at hand. In terms of hospitalizations, this is one of the most encouraging data points we've had in many months. You'll see it very clearly on the graph, but we are now in a much, much better place in terms of residents hospitalized, with 6 currently hospitalized in Ulster County, 1 of them, unfortunately, in an ICU bed on a ventilator. But as you can see on the graph, for many weeks and actually for many months, we were above 30 and approaching 40 hospitalized, and we've had a dramatic decline in that dimension, which is very, very good news. We need to get that to 0, of course. The other metric that is now showing a clear trend of encouragement, or a clear encouraging trend, I should say, is the number of total active cases in the county. We are now down to 1,650. Once again, very clear to visually see this. And the number that we're at now, we really haven't been at since right around really the beginning of the holiday season, so going back to end of November or early December. So it's been several months of sustained, unprecedented high levels of active cases, and now we're finally ticking down. So thank you to everybody doing the work to make that happen. The one point that we are still watching, and this number is not as low as I would like yet, this is the new positive infection rate in the county. Ultimately, until we get this number down to 0 or at least below 1, we will still be in a situation where there's risk and concern. Our new infection rate in the county in the last 96 hours is still at 4.58%. 4.58%. In the last 4 days, we have tested 3,883, and had 178 new positive cases out of that almost 4,000. Once again, 4.58% new infection rate. That basically tells us that we still are on that precipice of being near a community spread dynamic. So while the total active cases are coming down, there's still reason to be very deliberate and cautious about the fact that there's still spread of COVID around the county, and we absolutely must continue to wear masks to maintain distance and hand wash and avoid gatherings and so on. Looking out at the longer term projection, we are starting to see this curve begin to flatten down, and that is also cause for good news. Hospital capacity forward looking, once again, you can see our current capacity is the lowest it's been since back in November. And we have much more capacity in terms of beds and so on than is needed in the both near, medium, and long term. So that is also good news. As always, I want to caveat that with the fact that we've seen that whenever we make progress against this thing, this virus and the pandemic, it has a mind of its own and does what viruses do, which is figure out a way to continue to spread. And of course, we have seen some very small number of the UK variants in Ulster County, and now we did see our first reported case from, as we heard from the governor, of other variants in the state, not in Ulster County. So we have to continue to be vigilant. We have to keep our guard up. We have to continue to, once again, I'll say it over and over, wear masks, maintain that social distance, hand wash, avoid gatherings. We're still in this, and until we can get the vaccination percentage up and get herd immunity in that way, to be frank, we're going to be in this situation for several more months. So I know that's not what we want to hear, but we've made it this far, almost a year, so we have to continue to hang in there. We have to continue to follow those precautions. Switching gears to vaccines. Once again, I am continue to be and have been frustrated at the pace with which this is happening, but we are making progress in getting vaccines out to Ulster County residents, and I will continue to push in every possible way I can to speed that up. Unfortunately, this week, our Ulster County allocation for doses is exactly the same as it was last week, so a total of 1,500 doses have been allocated to us. The other challenge we're experiencing from a logistical perspective is normally by now we would have received these vaccines that we've been allocated several days ago, but because of the national weather disruptions that happened across the middle of the country from Texas all the way up to the Midwest, we have actually seen a delay in the arrival of those allocated vaccines. So we in Ulster County and across the state have had to push back and postpone, unfortunately, some of the pod clinics that we were planning to run both yesterday and today, which there's really nothing we could do in our control or at the state level because of the disruption in the supply chain due to that national weather event that happened earlier in the week. We do know that we will get these doses. At this point, we're just basically shifting everybody's appointments a day or two to the right on the calendar, and we're communicating with those folks directly on that. Here's the breakdown of where those 1,500 doses have been and will be allocated as they're received. Similar to what we got last week, 100 doses going to directly to hospitals and healthcare providers for their 1A healthcare workers. We have gotten through in the county and in the state the vast preponderance of our healthcare workers, which is very, very good news. The folks at great risk, given that they're still working with COVID patients. In the 1B category, we received 700 doses for our essential workers. Those are being administered in our county-led pod sites in Kingston and Ellenville. And I'll talk more about this in a moment, but those are right now especially being prioritized for those frontline workers that also have underlying health conditions, putting them at greater risk. And then finally, for our seniors, we throughout the county, there were 700 doses allocated. Those are not coming directly to our county health department. They are going either to private pharmacies or to some of our federally qualified health centers. I'll put that list up here in a moment. I've said this before, and I'll continue to say it. I feel, and I have voiced this concern, that this kind of very confusing and disaggregated system is a problem. I know it's making it hard for so many of our residents to have to navigate multiple different paths here. I have and will continue to push to centralize this and make it easier and simpler for everyone, especially for seniors who are now having to go to different pharmacy sites or find different locations. We're doing everything we can through our Office for the Aging and with our Recovery Service Center to help, but I have heard and continue to hear and agree with the frustrations, and I'll continue to advocate to improve that. But to be clear, that's a state decision and to somewhat of a degree a federal decision of how those are being allocated right now. Here are the list of those facilities, both pharmacies and federally qualified health centers who are providing the senior vaccines. You can see 4 of our health centers in Kingston, Ellenville, and New Paltz, and then also 3 pharmacies, a Walgreens and a Rite Aid, as well as Neil and team at Village Apothecary, who continue to do everybody's doing a phenomenal job. But I especially want to thank Neil and the team at Village Apothecary, who are running with local leaders on the ground who ran pod sites down in Marlborough earlier this week to make sure folks in the southern part of the county are getting supported, and as well as down in Ellenville, working with the Ellenville NAACP chapter to make sure that with the limited supply we have, we're being as equitable as possible geographically and demographically, and particularly ensuring that folks in our communities of color are getting fair access to what is a very limited supply of vaccine right now. So thanks to everybody doing that work. In terms of what you all need to and can do to make sure you are ready and signed up to get the vaccine once we get more supply, it's simple. You need to just sign up on our Ulster County pre-registration list. You can do that by going to vaccinateulster.com. That will put you on the list and give you some rough sense, which I'll talk more about in a moment, of when you'll be eligible. This is all dependent on supply and how quickly the federal government can ramp that supply up. The more supply we have, the faster we can go. And I'll talk more about that in a moment. But the call to action, if you haven't already signed up, is to go to our pre-registration list, vaccinateulster.com. You can also call our Recovery Service Center if you're not able to get online. That number is 845-443-8888, 443-8888. Thank you for putting it up on screen as well. A few caveats, though, again, to just be fully transparent and candid about where we are with vaccines right now. We have about 10 times as many people eligible as we have vaccines available right now, which is that is the challenge we're facing. I talked about this in my last update. I'm going to put up a slide with a bunch of numbers on it, but the number that I want you to primarily focus on is that very bottom one. Starting this week in New York State and in New York State, across the state, we added a significant new group of folks with underlying health conditions who are eligible. And what that means in Ulster County, where we have 180,000 residents, is that 120,000 of us are now eligible under these broadened eligibility criteria. So just think about the math there, 120,000 eligible, and we got 1,500 doses this week. So we're continuing to push to get more supply, but until that picks up, there will be a lot of people who are eligible, but who will have to wait some period of time. Given that, as I talked about in my last update, what we really wanted to do is, with limited supply, make sure that we're focusing that limited supply on those at the greatest risk. And so we laid out what I know is a fairly comprehensive and I know could be confusing. We're hoping to not make it confusing, but I know there's a lot of different pieces here, so I want to talk through that again. We laid out that list to help us prioritize with the limited supply and make sure we're getting those at greatest risk. And using all of the data and the health research we now know about COVID, we know that really the 3 dynamics are age, underlying health conditions, and whether you have to work and are required to work in an essential job that means you have to be interacting with the public. So we're focusing the limited doses we have on folks that meet 2 or more of those criteria. So what does that look like? I'll put up this chart. What I want you to really focus on here is that with the small numbers of doses that we do have, we are starting with those that are 75 and older, along with our essential workers that have those underlying health conditions. This, to be clear, this list is for the site that the county is running. If you are a senior, 65 plus, regardless of your health conditions, you can still absolutely go to those other sites that I mentioned. But this is the criteria that we're using as a county at our pod sites to prioritize the limited supply that we do have. Once again, you can go to vaccinateulster.com to get on the pre-registration list, and you'll get a sense of where you fall here. I know these estimated times on the far right of this chart are very frustrating and concerning. I want to be clear that those projected times are based on the current very slow rate of supply. If we can get the supply picked up from the state and federal government, we can do this much, much faster. And I'll talk about what we're doing to that end here in a moment, which is the positive update that I wanted to share. Before I do that, though, I do want to put up on the screen again what is a very comprehensive list of 16 underlying health conditions. Anybody that falls in these categories is now eligible, and in Ulster County, that's about 50,000 additional folks who are now eligible that meet one or more of these underlying health conditions. How do we get from the point we're at where we have lots of people eligible, but we don't have the availability? The way we do that is simple. Conceptually, anyway, we need more vaccine supply here in Ulster County, and I'll continue to say this over and over to anybody that will listen. And to that end, the significant update I did want to share today, I did send a letter today directly to Governor Cuomo in following up in what was a really productive discussion that we had along with other county leaders earlier this week, where I think in a very positive way the governor offered to work with counties to set up joint county and state, so joint state and county vaccination sites. And I specifically asked today in my letter for the governor to, as soon as possible, identify and open up one of those joint sites in Kingston at our current county-led pod at the Kingston High School Fieldhouse, the Kate Walton Fieldhouse. We saw yesterday the state announce 4 additional of these sites. And I think it's absolutely critical that we here in Ulster County and in the Mid-Hudson region have a state, or in this case, a joint site that is closer to and more accessible for our residents, especially our residents for whom it's just not possible to go to Westchester or Albany, or I know in many cases near the Canadian border or other far-flung parts of the state. So I think it's, as we get more supply, absolutely essential that Ulster County and the region have one of these joint sites. The good news here is that we've done the vast majority of the work thanks to our great health team and emergency operations team. We have our pod site up and running. It's been running for 6+ weeks, very successful and effective. And if we have adequate supply, we could have 50,000 people vaccinated per month in that site at our county-led site. And that would mean with our county population that we could get every single resident in the county vaccinated in a 2 to 3 month time period. So just to give people a sense of the holdup, it's not our ability to get it out. It's really the shortage of supply. And so my hope and my ask is that if we can get our county site upgraded, if you will, to a joint state and county site, that'll put us in a stronger position to make sure that our residents here have easier and more equitable access. And I've been really encouraged by the conversations I've been having with the governor and his team about this. I know that they're committed to doing this as soon as they can get more supply and get this going. So I'm optimistic that we'll be able to make that happen hopefully soon. In a letter, I asked for it to be immediate. I understand that everyone across the state has need, but I will continue to advocate strongly and vocally for every single resident of our county, just to make sure that we have that fair and equal access to that vaccine supply. So that is the bulk of the COVID update in terms of current infection rates and situation, as well as what we're doing to get the vaccine out quickly, safely, and equitably. The only other thing that I wanted to share with you all is part of the broader work that we've been doing to help our community be resilient through this crisis, not just in terms of public health, but in terms of all the economic impacts and other pressures on our families. I was very excited in my State of the County address 2 days ago to announce that Ulster County is the first county in the country to launch a pilot project for universal basic income. That's a lot of wonky terms, of what that really means is we will be providing direct cash relief to needy Ulster County residents. This is really an extension of the work we've been doing for almost a year through Project Resilience, where we delivered almost 500,000 meals to people's doors and continue to do so, where we provided childcare services, where we supported food banks, where we helped our local businesses, and a whole host of other support and relief we've provided to those in our community. This is another addition to that, and a really, I think, bold idea that's starting to gain traction around the country. And this puts Ulster County really on the leading edge of trying new approaches to get direct relief to folks. We've seen at the federal level the impact that direct relief checks had for tens of millions of Americans over the last year, many of whom were able to keep food on the table or keep a roof over their family's head with that check. And so the idea is to do that at the local level. This is a sort of smaller scale pilot where we only have funding initially to support 100 families. But for those that are interested and eligible, we highly encourage you to sign up. I'll put up the link for you to sign up. The way it'll work is if you're eligible, you sign up here. There will be a lottery to choose the families that will be able to participate. Unfortunately, I wish we could do this for more, but I'm excited that we can do it for as many as we can. You can go to projectresilienceUBI.com, projectresilienceUBI.com. That's also, you can get to it on our normal COVID-19 site as well. We've already had hundreds of folks sign up for this in just the last 48 hours, which is encouraging, but also gives us an honest sense of how much need there is right now in our county. So in addition, again, to this UBI program, which I'm really excited about, we have a whole host of other things that we can do for our residents in need in terms of food and rent assistance and business loans and grants, as well as mental health services, addiction recovery services, all of those critical services that the county provides. If you need help or know someone who does, I'd encourage you to have them call our Recovery Service Center. Once again, that number is 443-8888, and they can connect you with any of those different programs and services that we have. As we wrap up, I want to thank you all for joining. I want to thank you for continuing to be patient and as optimistic as we can be in the midst of what I know is a really tough time. And let's please continue to do that. Whenever I think about the challenges that we've been through, I very much think about our frontline workers who have put themselves at especially high risk to make sure that we can do the things we need to do. So I want to thank all of our frontline workers here in the county. This is becoming a common theme this winter, but once again, I want to single out our county DPW team and road crews, our county emergency operations team at our 911 center, and all the folks out there at the town level and city and village level working to once again keep our roads safe and clear in what feels like, I don't even know how many storms we're up to at this point. I will say about this storm, we are starting to see the rate pick up now. It's expected to be a lower intensity but a longer duration storm through today, through tonight, into tomorrow, Friday morning. So please be mindful of that and be cautious. And thank you to our great teams and folks out there doing one of the noble forms of public service to keep our roads and infrastructure open. Again, thanks to everybody for joining. Thanks to Radio Kingston and Diane and Manuel. And I'll put up as we exit again that Recovery Service Center number. If you have anything that you need, please reach out. We will continue to be here for each other through this difficult time. Next update will be Tuesday at 3 p.m. And in the meantime, stay safe out there on the road, stay healthy, and stay resilient.